Welcome again to Family Matters Fertility Center Health Talks, and this is your fertility specialist, obstetrician and gynecologist, Dr. Q Diale. Now, what are some of the things that you can do for yourself to actually avoid all these complication risks that are associated with PCOS? Now, you need to find a way to fight back PCOS on your own. First and foremost, and it's a very common one that you often hear doctors say, and that is avoid weight gain. Just avoid. It is easier to avoid weight gain than to actually lose the weight that you've already gained. Studies have shown that even a 5% increase in weight can result in a higher risk of developing metabolic syndrome. So it's easier to avoid gaining it. Prevention is still better than cure. Now, if you are obese or already overweight, it's very important to focus on weight loss. Remember, this is a metabolic condition. So even a 10% reduction in your overall body weight can result in a better function of the body and better hormone levels and better ovulation as well. So it is important to focus on weight loss. There are many ways to achieve weight loss, and one of them is to increase physical activity. Increasing physical activity then means that you reduce the time that you spend sitting. You need to be active at most times, or dedicate a certain amount of time per day that you allocate to exercise. So exercise will be anything that makes or anything that ensures contraction of the muscles. Contraction of the muscles then reduces inflammation and insulin resistance. So this needs you to therefore focus on strength exercises. Use those weights for muscle contraction. Again, it is important to at least put aside 15 minutes on a daily basis or 5 days a week just for physical or strenuous exercise. So one other thing that you can also do for yourself is to choose healthy food choices. Having to eat is not a choice, but what you eat can be a choice. So choose healthy options, and this includes high fiber intake diets and increase on protein. These have been found to reduce inflammation, which is one of the complications or associated factors with PCOS. So reduction of inflammation is important. Fiber assists with that, and protein. So it's about time that you start snacking on those nuts and whole grains. Again, it is very important to focus on relaxation as well, which is getting adequate sleep. Getting adequate sleep of at least 7 hours in a day has been shown in studies to be associated with reduction of inflammation and reduction in insulin resistance. It helps with that. For some of the cosmetic effects of PCOS, like excess hair, women that find themselves having a lot of beard or mustache, easy things like shaving for yourself can be ways of managing such. Waxing is also an option, and even laser and electrolysis can be done. Now, when you get to a medical practitioner, they can have a few recommendations of medication that you can take. One of them is insulin sensitizers. These insulin sensitizers work according to the abnormality that is found in PCOS, which is high insulin levels. Now, these insulin sensitizers work on reducing the amount of insulin that is in the body, therefore reducing androgens and then regulating body function. These are known as metformin and other supplements like myoinositol and D-chiroinositol. Now, other practitioners may recommend that you go on hormone treatment. These hormone treatments assist with controlling acne and controlling excess hair that is found in the body. And they also then regulate the period. Remember, they do not actually correct the fundamental abnormality in PCOS. The hormones that are recommended are oral contraceptives. And these contraceptives must be anti-androgenic, meaning they must have a progesterone that is able to work on the androgens, that is the pathology in PCOS. Other health factors that you really need to look out for once you have the diagnosis of PCOS is to get regular screenings of all the conditions that I've mentioned above. Regular screening of at least 6 monthly or at least once a year needs to be done, where you watch for your BMI, you check for your blood pressure, and you check for your glucose levels, where an oral glucose test can even be done to make sure that you are not at risk for diabetes. Again, you may need to have frequent checks with your psychologist if you have any of those mental conditions. Now, when it comes to PCOS and subfertility, your nearest fertility specialist will be able to assist. There are many options, and please do bear in mind that these options do not apply to every person that has got PCOS or that has been given the diagnosis of PCOS. So these can vary from subfertility, where we offer ovulation induction or ovulation stimulation, and this can be coupled with timed intercourse, and the treatment can vary also to include intrauterine insemination all the way to IVF and ICSI, and surgical interventions like ovarian drilling are also an option. So please do care that these are individualized. It is not for every patient with PCOS. So if you need further information on PCOS or subfertility, infertility, please don't hesitate to drop a comment, drop a question, and remember, do like and share our video for you to spread the information and knowledge. I'm Dr. Q, and I'm here for you.